Hello, I am Dr. Sujoy Chatterjee, consultant cardiothoracic surgeon at AIIMS Salt Lake Hospital. Heart surgery or bypass surgery is very scary for everyone. Whenever it comes to their mind, they think, oh, I have to stay on bed for months together. I can't go back to work. I can't do my normal activities. And now for this, we surgeons have developed a technique for around the last 10 years to do heart surgery by minimally invasive approach. Here we do not cut the main breastbone, and we do the surgery by means of a 2 to 3 inch incision on left or right side of the chest depending on the surgery that we are doing. The main advantages of this procedure is or are: number one, it's really a minimally access, so the time, as the word suggests, minimal, so the time for recovery is minimal. It's around 10 to 15 days time a person can get back to work, which normally takes around 45 days in other cases. And secondly, the cosmetic effect of the surgery. That means there is no external scar, so you can wear any kind of dress or anything because the scar is hidden behind the breast for females or it's on the sides for males. One thing I must always mention, that around 60 to 70% of the heart surgeries that we do are easily approachable by minimally access technique. But there are always 30 to 40% patients which cannot be done by minimally access. So in those cases, we never compromise on our ulterior motive of giving best to patient because of the access. So it has to be tailored. When it can be done, this is the best way, but when it cannot be done, we should not compromise on the motive of the cardiac surgery because of the access. Thank you.
मेरा नाम अखिलेश कुमार है, ये मेरे वाइफ है, इनका नाम रेशमी देवी है। इनका हार्ट में 3 फूटा था, जो डॉक्टर सुजय चटर्जी बाबू इनका ऑपरेशन किए। ये हॉस्पिटल का नाम आमरी हॉस्पिटल सॉल्ट लेक। अभी मेरा पेशेंट एकदम बढ़िया है, 3 दिन के बाद इनका डिस्चार्ज हो जाएगा, डॉक्टर साहब बोले हैं।
আমার নাম তারিকুল ইসলাম, পেশেন্ট মেহরুবা খাতুন আমার বউ। অনেক দিন ধরে মানে হার্টের প্রবলেমে ছিল, তো ডাক্তার সুজয় চ্যাটার্জির মানে নাম শুনেছি, বললো যে ভালো ডাক্তার, ওই জন্য আমরা আমরি হসপিটাল সল্টলেক আমরি হসপিটালে আমরা এসেছি। যা হোক অপারেশন সাকসেসফুল হয়েছে, খুব ভালো হয়েছে। হ্যাঁ, ডাক্তার সুজয় চ্যাটার্জি মানে অপারেশনটা করেছেন, উনি খুব ভালো হয়েছে অপারেশনটা। ধন্যবাদ।
আমি ডক্টর অশোক কুমার বর্মা, head of the Department of Cardiac Anesthesia, AMRI Salt Lake Hospital for last 14 to 15 years. We are doing many adult cardiac surgeries with a very good results and almost matching the results of the international standard. Our mortality is around 1% or maybe sometimes it is less than 1%. Recently, we are facing demand of the minimal invasive cardiac surgery, that is with the very small incisions and cosmetically very good, and that gives benefit post-operatively, very minimal pain, and patient can be discharged immediately within 3-4 days. So recently we have done one mitral valve replacements of the young female, which they are worried for the scar of the sternum because of the young age of the female. So we decided to go for the minimal invasive cardiac surgery, and there is a very small 1 or 2 inches incision below the breast that is also not visible after the operation, and we have done successfully mitral valve replacement, and the patient is almost discharged within 3 days. And another surgery, that is the atrial septal defect, that is the ASD closure, again the young female of 20-25 years old, and we have done again with the same method, and we have given incision of 1 to 2 inches just below the breast, and we have done one thoracotomy, and we successfully closed this is a hole, that is actually the hole in the heart, and we closed this ASD closure, and that patient also doing very well, and we are going to discharge in 3 days. So my minimal invasive surgery is now the future of in the cardiac surgery. Thank you.